Welcome to another Commonwealth Conversation. I'm Ryan Gilchrist. This is We Virginians, and joining us today is Quentin Kidd. He's the Dean of the College of Social Sciences at Christopher Newport University and Director of the Judy Ford Wasson Center for Public Policy. Welcome, Quentin.
Good to be with you.
As always, I'm joined by Marisa Porto, Executive in Residence at Hampton University and a longtime newspaper editor and publisher. Hello, Marisa.
Hello, nice to see you all today.
We're talking public policy and taking a look at the wide-ranging impacts of the coronavirus crisis on Virginia and, of course, beyond its borders, but specifically the Commonwealth. Marisa, where should we get started today?
Well, Quentin, maybe you can sort of do a scene setter with us with an explainer about how the pandemic has affected certain regions of Virginia and differently than others.
So, I think the pandemic probably has affected everybody to a certain extent across the Commonwealth, simply because some of the governor's policies, some of the governor's orders have been statewide. But if you live in an urbanized area where, we all live closer together, obviously it's affected us more. I say us because we live in Hampton Roads, a more urbanized area. We live closer to each other. We're more concerned about how we interact with each other. We've had higher cases of the coronavirus, in Hampton Roads, in Northern Virginia, to some extent in Richmond. But if you live in a rural area, you could very well not know anyone by an order of 2 or 3 who has had the virus or has died from the virus. And so your ability to sort of think through, right, how this is affecting me and should this be affecting my ability to go shopping and that sort of thing is vastly different from our perspective on how that might be affecting us. And I think this is why, to some extent, you see calls in the rural part of the state to open up now and to make the opening differently than Northern Virginia and Hampton Roads. And I think you'll still hear that that sort of divided voice even more. Very likely, you'll have regions of the state that where if you think about the curves, where there's a flattening curve more quickly than in other parts of the state. So it really does matter if you live next to somebody else or you live next to a large concentration of people. It matters more than if you don't. I mean, there's a reason New York City has had such a horrible time at this, and the rural parts of the country now are just starting to see some of the effects of this.
Okay. Can you tell us a little bit about there have been some issues around healthcare, issues around higher education and education itself. Can you tell us a little bit about the sort of top concerns that you see for the Commonwealth from a public policy standpoint because of the pandemic?
So the pandemic, I think, has put Medicaid expansion in an interesting light in Virginia. There are lots of Virginians who have access to health care because of Medicaid expansion at a time when a lot more Virginians need access to health care because of the pandemic, who otherwise wouldn't have had access to it. And we don't know this to be a fact yet, but I suspect that in rural hospital systems, having increased numbers of patients have access to healthcare is going to help rural hospital systems survive the pandemic, or survive in a better way. Sort of not suffer the fiscal consequences as badly as they might otherwise, because that access to healthcare gives you access to elective or non-emergency healthcare procedures that are how hospitals are traditionally have made their profits. And so you see, oddly enough, I think that's actually going to be a helpful thing for healthcare systems around the state. But we're in this really strange environment where we're in the middle of a healthcare crisis. All sorts of federal aid is rushing to hospital systems, but hospital systems are having to use all their resources in ways where they don't make money: emergency room, ICU. And all of the ways they do make money have been cut off for the last couple of months, all those elective procedures. And so hospital systems we saw with Centera recently, where they're cutting salaries of doctors and furloughing people at the very time when a lot of people think, well, hospitals have never been busier. Well, that's right. They've never been busier in ways that make them lose money, and they've never been less busy in ways that help them make money. And so I think coming out of the other end of this, we may see a focus on healthcare that looks differently than it did over the last 4, 5, 8 years, where it's been all about Medicaid expansion and Obamacare. We may look at healthcare differently, and that may affect public policy toward healthcare differently.
Interesting.
Quentin, are you seeing, in terms of things that the elected officials are discussing, clearly there are some bipartisan issues that are popping up as part of the effects of coronavirus, but can you give me a sense also of some issues where there's a bit of a divide, and how can we reconcile those, particularly before we get back around to the next General Assembly session?
So I see the divide. I see the divide politically through the lens of two strands of culture that have always run through American society: the individualistic strand and the communitarian strand. And so you generally see Democrats, and you see this in Governor Northam, and you see this in other Democrats around the country, speak about the need to respond to this pandemic in a very communitarian way. And then you see, generally speaking, I realize that there's an exception to every generality, but generally speaking, in Virginia, you're seeing Republicans sort of snipe a little bit at the governor in language that is very individualistic in its undertones. And you see the protests that have happened. We've had some of them in Richmond, but you see them around the country. Those are very individualistic oriented protests. People who don't want to have to wear masks in public and do the things that we're being asked to do because it's a part of the community response to a pandemic. And so the pandemic has brought to bear these two strands of culture that have always existed in American society, and they're taking on the clothing, if you will, of the two parties, the two dominant parties, Democrats and Republicans. And that analogy or that comparison only goes so far. There are states that are run by Republicans, Republican governors, who are asking their citizens to do communitarian type things. But even in those states, you're getting pushback, you're getting protests at the Capitol and things like that. And so I see that playing out quite prevalently in Virginia. And as a result of that, you may see what we saw last week in the May local elections, in May 19th elections. Stanton was taken over by Republicans. Stanton, which has been a Democratic city for a long time, is now controlled by Republicans, because that sort of individualistic groundswell of energy may actually be helpful to Republican candidates locally in these local elections. And of course, it's local elections in Virginia where Republicans rose to statewide prominence in the 80s and 90s. And so oddly enough, the pandemic may help Republicans in Virginia in ways that Republicans have struggled to figure out how to confront this sort of Democratic dominance in the state. There may be a groundswell of Republican energy that comes up as a result of this pandemic, comes up from an individualistic sort of cultural response to the efforts to have us respond in a communitarian way.
Very interesting. So can you tell us how this pandemic, what kind of long-term effects it might have on, say, education, public policy, where there's still a struggle to determine what to do from early childhood education, and then all the way up through high school and now in higher education. Do you see any long-term public policy issues there?
Tons of them. Of course, I live in this every day. We're as I speak, Christopher Newport University and all universities are trying to figure out what to do this fall. Every high school Every public, school system in the state is trying to figure out what to do. Every private school. There are a couple of thoughts that come to mind. Number one, at a universities across the Commonwealth, I'll just speak about universities first. Universities across the Commonwealth, I think, even those that do a large number of online or virtual courses, all want desperately to come back in the fall. And part of it is a financial thing. All of these universities have big mortgages that they've got to be paying on dorm rooms and football stadiums and, dining halls. These are things that the Commonwealth of Virginia doesn't pay for. The Commonwealth will build an academic building, but it won't build a dorm and pay for it. It'll guarantee the note on a dorm, but the students who pay the dorm fees have to pay the mortgage. And so if the universities don't come back in the fall, they're going to have a hard time paying the mortgages on those dorms, and the Commonwealth of Virginia is a guarantor of those mortgages. And so the fiscal impact on the Commonwealth could be tremendous if universities don't open. And so there's a great desire on the part of universities to open. But in general, in education, whether it's K-12 or higher ed, there's a great rethinking about how adaptable we have to be to change very quickly our mode of education. I mean, you build a class around the idea that you're going to be in a room, a 30 by 20 room with 15 or 20 students face to face for several weeks. And then suddenly you can't do that. And for a lot of teachers all over the Commonwealth, it was really difficult to transition within a week to 10 days from that model to online. And so I think there's a lot of thinking going on about how we have to be prepared to do perhaps the same thing again this fall. If we have this second spike that happens in November, December timeframe. And so nobody has answers right now. I can tell you that. I mean, I'm involved in a lot of, group chats and listservs and all that about education in Virginia. Nobody has answers. Everyone is talking about it. If there's one thing I can say though, that one conclusion that I hear very commonly, and that is K-12 all the way up to higher ed. And that is, people weren't as impressed with online education as they thought they might be, given everything that had been written about it over the last decade. And there's a great desire, if you're used to teaching in class, there's a great desire to go back to it. And I hear that across the board, K-12, higher ed. There are very few strong advocates of going totally virtually these days. I think a lot of people suffered through that very quick transition, and they don't want to do that again.
Right. We've had a number of guests on the program talk about sort of the process by which public policy is made in Virginia, as some legislators talking about everything from potential for more digital records, and then you clearly saw that second session where folks are sitting outside. I guess I wonder, from your perspective, how is the process of putting together laws going to change in Virginia because of the pandemic?
I'm not sure that it will change. So part of it may change, but I'm not sure a lot of it will change. The process is probably going to stay very similar, and that is, laws are the result of negotiations between people and groups. They're the result of lobbying. They're the result of analysis of society and the problems that we have in society, and then laws are supposed to be solutions. I don't think any of that changes. It may be that physically the way lawmakers organize themselves in session change. We're used to having chambers that look very much like Greek and Roman, ancient Greek and Roman legislative chambers. You just envision the House and the Senate in Virginia or the House and the Senate in the Capitol. Those physical structural layouts, go back thousands of years in terms of their influence. Some of that may change. I mean, we may have situations where, due to health concerns, due to the age of legislators, some of those seats are empty, and some of those legislators are sitting in their offices virtually engaging in a debate. But I still think even that is temporary. At the end of the day, when we have a medical healthcare solution to the pandemic or to the coronavirus, a shot or something like that, I think people will rush back to sitting together in that chamber, because there's something about debating a bill, all in that same room, hearing the passion and seeing the passion. I think there's something about that people don't want to give up. They don't want to go to virtual legislative bodies or virtual meetings. And then that doesn't even speak to the technical issues involved in some sort of virtual type legislative body, where how do you make FOIA work? How do you open something up to the audience of citizens? So I suspect that while in the next legislative session we may see some social distancing and some virtual participation, very quickly, if people can come back to that chamber and sit next to each other, they will.
So can you tell us a little bit about how you think the economic recovery from the pandemic will happen across Virginia? What will it look like, let's say, in Northern Virginia versus Wise County or some of the other rural areas? I mean, what do you expect from the economics here?
So great unfairness in some ways. In some ways, the parts of the state, the Commonwealth that have done well economically over the last several decades will probably recover well economically, and the parts of the state that have struggled in the last several decades will probably struggle to recover to some extent. Virginia happens to have its two largest metropolitan regions. Its two biggest employers, its two biggest economic engines happen to be the federal government in Northern Virginia and in Hampton Roads. The military is not going to stop spending. They may cut back here and there, but as a general rule, the military is not going to stop spending. We're not going to, get rid of the Navy or get rid of the Air Force or the Army. And so to some extent, Hampton Roads, we've always been blessed with a floor. Whenever there's a national recession, we recess, but we don't recess as badly as some areas do. Whenever there's an economic boom, we boom a little bit, but we don't boom as much because we have that federal spending that sort of keeps us within a band. In Northern Virginia, to some extent, is that way, not as much because their economy is more diverse and bigger. But you go out across the Shenandoah Valley, you go to Southwest Virginia, Wise County in the coal country, you go to Southside Virginia, Danville and places like that. They may struggle to recover because they don't have that kind of spending. They don't have the big industries that might be able to to sort of hold on through the pandemic. And so the recovery in rural Virginia might be slower. You think about your local restaurant that you really like, a small local restaurant that you really like, and it may or may not go out of business in Hampton Roads. If it goes out of business, it's very likely that another one will come back into that same spot, within a few months. But if you're in Martinsville and the local restaurant that you really like struggled and went out of business, another one may not come into that spot for a year or more. And so it may be that the recovery in rural Virginia is slower and the suffering is longer economically than in the urban parts of Virginia, Northern Virginia, Hampton Roads, and Richmond to some extent.
Do you see any positive impact at all about the pandemic long term or on Virginia, the Commonwealth? Is there anything that came out of this that will make the Commonwealth better in some way?
Probably nothing that's unique to Virginia, at least off the top of my head, that isn't also common to the rest of the country and perhaps the world. I mean, look, out of pandemics come in some ways great things. I mean, we have the sewer system because because of the Black Plague, and we have a flu shot because of the pandemic of 1918. And so out of this may come some things that we can look back on 20, 30 years from now and say we have that because of the coronavirus pandemic. For example, we may have an immunization shot as a result of this that is based upon our individual genetic makeup, as opposed to a flu shot that is, one size fits all, so to speak, in terms of medicine. So we may come out of this with some medical innovations that none of us can sort of see right now. We may come out of this with some social distancing norms that were uncommon, if not never practiced before. We may wear face masks more than we ever did in the past. We may be more conscious of things like coughing in front of other people. So I think there will be things that come out of this, positives that probably improve society that we can't particularly see right now. And you can just look back in history and see some of the major changes, major ways in which we live that were influenced by pandemics or great health crises. And I have no reason to think that this one won't be the same. I mean, that there will be some innovations or some improvements in the way we live as a result of this that we may not be able to see right now.
And just one last question, and that is, do you see any long-term public policy changes or innovations coming out of this for the Commonwealth?
I think the big one is going to be focused on our healthcare system. Hospital systems, the medical system generally, is taking a massive hit financially over this, and so we may have to rethink how our hospital systems work in terms of their fiscal health. I mean, the two big healthcare systems that are university systems in the state, the UVA and VCU, have really taken it on the chin in terms of this pandemic, and so we're going to have to rethink all of that, I think. And again, I don't know that is a Virginia specific problem. I think this is probably something that's going to be this is an issue that's going to be felt across the country, and so it may be a national public policy problem as well as a Virginia public policy problem or challenge maybe. It may be that there will be changes in public policy related education that we can't see right now, in terms of how adaptable we are to shifting virtually. And there may be some uniquenesses in Virginia or along the eastern seaboard, because I always tell my faculty at the beginning of the year, you ought to be prepared to go online if you need to for a week to 10 days because we live in a hurricane zone. Last August, when we had our college faculty meeting, and I said that, never in my wildest imagination would I have thought that you're going to need to go online for the rest of the spring semester because of a pandemic. And so we may have to think about our adaptability in terms of higher ed, but I think we're going to have to think seriously about the healthcare system and our healthcare delivery probably much more substantially, because we're going to come out of the other end of this with healthcare systems, hospital systems that are in dire fiscal straits, and we have to have them. We have to have access to healthcare. So we can't just let healthcare disappear because the market drives it out. We've got to have it, and so I think that's going to be the big long-term rethink in terms of public policy, is going to be how healthcare makes its money versus the kind of healthcare that we have to have in an emergency. And those two things are very different.
Right. Well, this has been a fascinating conversation. We can have you on several more times to talk about this topic. So I will invite you back at some point, and I really appreciate your coming today and joining us and sharing your insights. Thank you.
Thanks for having me. I really appreciate it.
Thank you, Marisa. Thank you again, Quentin Kidd from CNU and the Judy Ford Wasson Center for Public Policy. Thank you to all of those watching this video. If you've made it this far, we'd really appreciate it if you'd like this video. Certainly subscribe to the channel. More conversations are coming. For now, thank you very much.